You cannot use it. Because it's single use, we are saving the time. And another benefit is it is always maintain the center of the root canal system. One of the objectives is to maintain the original shape and centering of the canal. It is very important. But this file, they are claiming, yes, only the file which maintain the center of the canal. Yes, it maintain it. That we need for root canal during root canal preparation. That is 3 files. Again, we have shown here. This is the small file. That small file, it is 6% taper. And the ISO number is 21. Usually we know the number is 20, but here the number they have changed, it is 21. The tip diameter is 21. And the tapering is 6% taper. And with this file, all the small canal you can prepare, only one file. And this is primary file. This file is used for most of the canal, except the small canal and the large canal. They have defined here, small canal is only the mandibular anterior teeth, and the mesiobuccal canal and the mandibular incisor teeth. This canal is considered as small. And large, which one? That is distal canal of the molar, mandibular molar, palatal canal of the maxillary molar, and the single rotate or single canal premolar are treated as the large canal. Without this, all the canal you can treat with the. Then another one is the large file. It is 8% taper. The tip diameter is 25, ISO 25, and the tapering is 8% taper. And this is the large file, it is the number 40. And the tip diameter is called, that is number 40, ISO standard is 40. And the tapering is 8% taper, it is. This is the cross section, here also the file. You see, that is in the coronal portion, that is this, it is a triangular shape. And it is aggressively cut it, very aggressively cut here. Instead of the coronal enlargement file, you can use, that is, here, that is at the 13 millimeter. Here the canal is cut very aggressively and it is the orifice shaper. Here the orifice shape easily. And in the apex, it works very gently. That is why the file never break. And the tip is the blunt tip, you see, non-cutting tip. And there is no chance of transportation or perforation if your working length is correct. And this is the wave 1 machine. This machine is only for the wave 1 and it has 2 functions. That is reciprocating movement. That is, it is counterclockwise and clockwise. Counterclockwise and clockwise movement. 3 movement makes 1 circle. That is, you have used previously, that is reciprocating handpiece also. Previously we used it for root canal preparation. They maintain that idea. And it has another advantage, that is rotary movement. That is why you can use this motor for every type of rotary instrument in this motor. This is the movement, how the file moves. It is not continuous motion, clockwise, anti-clockwise, clockwise, anti-clockwise. Shaping, that is, this is the file, number 1 picture. Then paper point, the similar size paper point, that is called the small paper point. A small 5 corresponding to the small paper point. Then gata persa, same number gata persa for the small canal. It has 3 file, 3 as absorbent point and 3 gata persa. And the last one is the thermoplasticized gata persa. These are the paper point, 3 sizes paper point, small, primary and long. This is the gata persa, 3 sizes gata persa and 3 sizes wave 1 obturators. But when you prepare the root canal using the wave 1 system, you cannot use the other gata persa here. You cannot use the other absorbent point also. You must have used this persa, gata persa, paper point and the obturator. This is the oven you can use for the observation of the, very easy, very, very easy. Now the sequence, very quickly I will say that, as because there is a shortage of time. Create a straight line access to the canal orifice with emphasis on the key flaring, flattening, and finishing. After this, you can use only the wave-1 instrument. Otherwise, you should not use the wave-1 instrument. Otherwise, there is every chance of fracture of the instrument. Remember it. And before you use the wave-1, you must negotiate the canal with the stainless steel file. This is one of the prerequisites. You must make the glide path. Without glide path, you cannot enter the wave-1 file into the canal. If number 10K file is resistance to the movement, that is, you introduce the number 10K file into the canal. If you feel the resistance, then you will use the small file for this canal, particularly for this canal. And this small file is the number 21, tip diameter is 21 and the 6% taper. Next, measure of the canal is which is with the primary file. That is, primary file is number 25 and tip diameter is, taper is 8% taper. And this is the large. How will you select it? If the number 20 file goes easily, then you will have to consider this canal is the large canal. Or when the number 10 is resistance, then you will have to consider it is the small canal. Otherwise, all the canals you will have to consider as a medium canal. And you can use the wave-1 primary file for all the canals, except this type of defined by the manufacturer, that is mandibular incisor teeth mesiobuccal 2 canals. Not one, mesiobuccal 2. This is accessory canal. For you will have to consider as a small canal. A large canal include the maxillary incisors and single canal bicuspid and the large diameter of the molar. That is distal canal of the mandibular molar and the palatal canal of the maxillary molar. And after selection of the file, you will have to make the glide path. It is very, very important. You can make it with the manual number 10 or number 15 file or by rotary system. In rotary system, you can use the path file. That is called path file. 3 file is there required. Path file. Number 13, number 16 and number 19. Path file. Or now, they have supplied another file that is called Pro Glide file. That is tip diameter is 17. It is average they have done. It is 17 diameter, ISO diameter. And with the manual instrument or the rotary instrument, you can make the glide path. And without making the glide path, you should not use the wave-1 file. This is the number 10 or 15, or these are the path file. This 3 file is the path file. It is also rotary. This rotary, that is nitty. It is nitty file. That is number 13, number 16, and number. And if you want to use only one file, then it will be the number 17. That is called Pro Glide file. Pro Glide file. One file is required instead of 3 files. Then shape with the wave-1 motor you can use, and you can prepare the canal. And this canal is prepared by the Pro Glide and the path file. Yes, first we have negotiated with the rotary instrument, not by hand. And then we use the first you will have to negotiate all the rotary system. First you will have to consider that is the apical 1/3, middle 1/3 and the cervical 1/3 or coronal 1/3. First you will have to negotiate the coronal 1/3. Negotiate with the number 10 or number 15 or number 25. It depends on the size of the canal, which file you will use. Otherwise you can use the path file or the Pro Glide file, rotary system. Then you will have to find out already you have decided which file you will use. And you can use that file up to the 2/3 of the canal, not more than that. Next, negotiate the full length with that previous file. And you'll have to take X-ray. That is, you'll have to find out the length of the canal, total length of the canal. And you'll have to confirm it with the FX locator, whether the length is correct or not. Otherwise, there will be every chance of perforation, as because the instrument is not under your control. Then you use the appropriate wave 1 file to the full working length. Very easy. And in every time, you will have to confirm the patency of the canal. If you use the 3, 4, or 5 times the wave 1 file, then 5 times you will have to negotiate it. You will have to break the cutting dentine or materials inside the canal. You have to remove it, irrigate it properly. Then there will be no chance of fracture of the instrument. You must maintain it. If you want to do it 2 or 3 canals, then there is chance of fracture of the instrument. It will be definitely fracture. And clean the floors frequently and check the sign of distortion and wear. It is very also important. Every time when you are introducing the file inside the canal, the file is taking from the canal and you inspect it, clean it, and then check it. Is there any distorted sign or not? If there is sign of distortion, then you must change it, change the file. And every time you have to use the patency file, that is the negotiating file, to see the full length patency. And this is also important, that is irrigation. Every time you will have to irrigate it very properly. And this manufacturer recommended the endo-activator. It is best for cleaning, and I think our friend is using another device, and that is also very good, and I have gone through that literature, and you can use that instrument and irrigation system. This is the endo-activator. It's very simple. It has also 3 tips, like a small, medium, or primary, or the large. And the instrument can use in that situation. This is the tip diameter. That is the tip. This tip should be smaller than the prepared canal. If you prepared it, this 45, that is, it is the medium. The diameter should be, diameter of this end activator should be smaller than the preparation. Otherwise, there is chance of fracture. Just you put the irrigation solution and then you activate this. Very easy. And the price is also very reasonable. I think so. You see that the lateral canal, accessory canal, everywhere the irrigation solution is going. And this canal is not possible to shape. Preparation of the canal, you should not give pressure, extra pressure. Just light pressures, simple touch. If you give the pressure, then there is a chance of separation of the instrument. You must maintain it. Like school boys, during their learning, what they do? You are giving the pencil and they are breaking. You are giving the new pencil, they are breaking. You are giving the new pencil, they are breaking. Why? They are giving the extra pressure. And this instrument is also like that. You should not give any extra pressure. Just a little pressure, just forward movement. And this is the last video, that is how the wave 1 file works. First is straight line exercise. And then negotiation of the canal. First you will have to negotiate 2/3 of the canal. with the number 10 file here used. These were the tooth prepared with wave 1 instrument. That's number 10 file is used. You cannot prepare this type of canal, never. That is interconnecting canal. That you have to clean it, just clean. And you must fill up with the thermoplasticized gutta percha. Without that, the gutta percha will not enter into this. And then the space will be the empty space, and there is a chance of connection with the external surface of the tooth, and there is a chance of reinfection of the canal. Then negotiation is done. Then the selection of the file, which file we will use. That is primary file here they are used. A little or gentle pressure you will have to use. The file will goes itself inside the canal. Just you see the movement. And another thing is that during negotiation of the canal, you should not move the file continuously. Just you should move the file, that is clockwise and clockwise, and a little pressure forward movement, little pressure forward movement. And every time you will have to clean it. 10 file again. How the 10 file is used? You see, it is not continuous motion. Just clockwise, anti-clockwise, clockwise, anti-clockwise, forward movement, clockwise, anti-clockwise, and forward movement. No continuous motion. Dentin engaging, that you see here, the dentin. And maintaining the original shape of the canal, they are maintaining the center of the canal also. You see, curvature is maintaining here. And now you establish the working length, and then again you use the same file, no other file. Sometimes you can use 2 files, as because when it becomes difficult, then you can use the previous number file you can use. When there is chance of fracture, if you understand, yes, there is chance of fracture, there is a more resistance, then you can use the previous file, smaller file you can use. Time is short, huh? Just a minute. This canal is prepared by the wave 1. I am shortening it because another one is waiting. The time is. This canal is prepared with the wave 1 system. Okay, sure. Thank you very much, everyone.
Thank you, Professor Samsul Alam. I think he has designed this topic, and actually we are really grateful, and really I think it will be helpful for me and for the audience. Thank you, Professor Samsul Alam. Is there any question? One question only. One question. If no, I have got one question.
Our nature.
If no canal, Professor Samsul?
C-shaped canal.
Yeah.
Thank you very much. It is very difficult. All the endodontic facing this difficult. And C-shaped canal, you cannot prepare it. No instrument is yet using. You can try, but I think it is very difficult to prepare it. You should just clean it. You will have to use the 5% to 5% sodium hypochlorite, and proper device you will have to use, like end activator, or like, what's the name of your device? Endo irrigator plus. That was very useful for this C-shaped canal. And you will have to activate it. That is the lateral force. You give the lateral force, and that lateral force inside the canal, it will goes into the every corner of the canals and the lateral canal, accessory canal, and just clean it, dry it with the prepper point, and then filled up with the thermoplasticized catapults or vertical condensation you can use. Thank you. Thank you, everybody. Thank you very much.
Dear participants, now I request our President of Bangladesh Academy of Dentistry International, Dr. Jahangir Kobir, to present the crest of honor to our presenter, Professor Dr. Samsul Alam, sir.
Now, I would like to invite our second speaker, Professor Dr. Masaru Murata, Professor of Oral and Maxillofacial Surgery, Hokkaido University of Japan.
যারা পিছনে আসো আমরা খুব মানে
Assalamu alaikum. I'm Dr. Murata from Hokkaido, northern part of Japan. Here. Pacific plate and Philippine plate come together near Japan. So we have much hot springs. Actually, we have much snow now. My house already covered with snow. It's my great pleasure to be here to address you about my new surgical technique. Today's title is dentin autograft for bone defect related with tooth old transplantation. I think this is warm medicine. I think so. My today's roadmap consists of Roman, ancient dentistry, dentin biology, and autograft. Do you know iron implant? In ancient Roman era, Roman people received iron implant like this. This paper was published in Nature, 1998. This was old implant dentistry. 100 years ago, Japanese scholar in literature, he gave us great message. Dentistry is a work of love. This message is very, very important. I like this message and I respect Professor Kanzo Uchimura. What is now love of work? I think dentin material is one of work of love in our field. Dentin is very small material, but great material. I'd like to show you dentin materials. Next is first clinical case of demineralized dentin matrix, we call DDM. More than 10 years ago, 2002, a 45-year-old male patient visit our university. He revealed malocclusion. There are non-functional teeth and bridge was broken. And you can see dentigerous cyst. He desired implant reconstruction. I focused on these non-functional tooths. I extracted two tooths here. I crushed and demineralized and washed. So this particular type is patient-own demineralized dentin matrix, patient-own DDM. This is clinical figure before operation. I opened window and patient-own DDM material graft like this for sinus lifting. you can see 1 day X-ray. 2 months later, very good dome shape. Lower X-ray is 10 years later, recent. Patient received EDM autograft or implant, and more than 10 years, no trouble. Patient is very happy. When I implanted the fixture, I took tissue biopsy. This is from, I'd like to become bridge between basic science and clinical scientist. I'd like to become.
আমার দুঃখিত আমার দেখি যে
I respect Professor Jurist. Professor Jurist was BMP discoverer. BMP is bone morphogenetic protein. I major in bone formation. Of course, I major in tooth. Professor Jurist